And a new study finds that dengue patients have a higher risk of long-term health complications, such as heart diseases and memory disorders, compared to those who contract COVID-19. Now, for more on this, we have with us infectious diseases expert, Professor Ooi Eng Eong, professor in the program in emerging infectious diseases at Duke-NUS Medical School. Professor Ooi, thank you so much for coming in.
Thanks for having me.
People who recover from dengue are at higher risk of long-term health complications than those who had COVID-19. Was this finding a surprise to you?
It is not a surprise, as we've known for some time that dengue does cause long-term complications. What is clarified in this study is the extent of these complications and that these people actually sought medical attention for. I mean, the fact that dengue causes long-term complications actually can be traced way back to 200 over years ago when dengue caused big outbreaks in North America because of the slave trade. And it was the famous doctor called Benjamin Rush that, because of his interactions with patients, first coined the term, that dengue shouldn't be called break bone fever, as was known then because of the pain in the body, but rather break heart fever, the heart, because a lot of his patients had depression after getting dengue, after recovering from dengue.
Okay.
So that the association between dengue and some of these long-term consequences have been known for a while, except that this study did two things. One is that a very large number of patients that they followed up on, and two, that these are problem enough that these people actually sought medical attention for.
So break down the details for us. Why is the chance of longer-term health complications from a dengue infection generally higher than that for COVID-19?
I think the simple answer to that is that in Singapore, our population had been vaccinated against COVID-19 before they started getting infection. Right? So in the study, at the time when it was done, we went through our Delta and Omicron wave. So we missed the first wave. We had already gotten our 2 doses, if not 3 doses, by the time the study started. In fact, the majority of the people they studied, 88% of them, I believe, over 80% of them had already gotten 3 doses. Whereas in dengue, none of us are vaccinated against dengue. And so I think that's the major difference. One group had been vaccinated and therefore gotten lower rates of long-term complications than dengue. In fact, if you compare the long COVID in Singapore compared to other parts of the world like United States and all that, where there are good data, Singapore's rates are very low.
Okay. And interestingly, the study looked at the heart, memory disorders and movement problems from COVID-19 and dengue. Are these common issues that are caused by an infectious disease most of the time?
Yeah, the underlying threat amongst all these diseases is inflammation.
Okay.
So inflammation, if you think of it, is like if you scratch yourself, your skin will become red, right? So now imagine inside your body, many parts of your body, there's inflammation going on. So what happens with diseases like COVID and dengue is that during the acute phase of disease, when you get fever and all that, what's going on is inflammation, because the body is saying something is not quite right here. It's like a fire alarm. It's sounding and say something is wrong here. Bring in all the right resources and tackle this. So the immune system does that. Now, in some people, not all, and in this case, the study only found about 2%, slightly over 2% from dengue, that the system doesn't quite reset.
Okay.
And that's why they get this long-term complication. Right? So the solution is, best is to be able to prevent infection entirely, then you won't get any of these problems.
Are there other complications that you feel experts need to look at more closely for a more to understand the bigger picture, the complete picture of how dengue and COVID-19 can affect the human body?
I think you're absolutely right. That's a very important question. I think this aspect of consequence of infectious disease has been neglected for a very long time. We often think of infectious disease as the acute phase of illness, right? You get this fever and then you recover within a week, and then a minority of people may not recover, get more severe disease, and a very, very small fraction then succumb to it. But actually the rate of this long-term complication can vary depending on what you look for. And several years ago, again, a study done in Singapore where they actively followed up dengue patients for over a year, and you find that about around 12% of dengue patients actually have issues that you mentioned earlier: poor memory, inability to concentrate, feeling very tired most of the time, right? And even infections like influenza, over a 3-month period, many actually have very prolonged cough that actually disturb their sleep and therefore their well-being and ability to work properly in the daytime.
So with all this information that we have on hand now, how would you assess the dengue control situation in Singapore? Is it under control? Should we be doing more?
I think the answer is always yes, we can do more. But at the same time, we have to acknowledge that Singapore is by far one of the best country in terms of dengue control. And what's happening in Singapore in some ways is that we are a victim of our own success, right? We have managed to control the mosquito population so well that we've reduced transmission to a very low rate, right? But what's acting against us is that because we reduce transmission, we also over time reduce the overall percentage of people that are immune to dengue. So now when you have introduction of virus, even despite the very small number of mosquitoes, because our population is very susceptible, a lot of us then get these outbreaks.
Sure.
Right? Yeah. So I think this part of the solution to that is that we need to incorporate with dengue mosquito control vaccination.
And what does this study mean, though, for post-recovery treatment for dengue and COVID-19 patients? How can this study be sort of a resource to help support public health planning in Singapore?
Unfortunately, there's no way of dealing with this once you've gotten it, right? I think the best way of dealing for people living with this, you just have to make sure that you get followed up with the doctors. Many of these are because they already have underlying disease, right? In the study, they showed that it's people older than 65 years old that are most at risk of this. And that's because they already have chronic diseases. So if you fall into that age group, best to get followed up with the doctors. But I think on the longer term, we need to think about vaccinating our population against dengue as well, particularly those people who are at risk of these long-term complications and the severe dengue. I don't think we need to vaccinate children, which is how WHO thinks about this. But in Singapore, we have a unique situation where our severe dengue cases are actually in older adults. And I think there we can actually make a difference with vaccination.
All right, hopefully we'll get there. Professor Ooi, thank you very much for coming in. Always a pleasure to speak with you. That was Professor Ooi Eng Eong, professor in the program in emerging diseases, infectious diseases at Duke-NUS Medical School.